Hi everyone, welcome to my second part of alcoholism series, and today I will be discussing about the toxic effects of alcohol metabolism. So in my first video of this alcoholism series, I had already discussed about the alcohol metabolism. So if you have not seen that, please do watch that part 1 video before seeing this. And now let's come to a topic proper, that is toxic effects of alcohol metabolism. So the first toxic effect is the depletion of NAD+. Let's see what it is. So we know that in the metabolism of alcohol, the first step is the ethanol becomes acetaldehyde, right? So this is by the enzyme alcohol dehydrogenase. And during this process, see, there will be an NAD+. An NAD+ is utilized. It will be reduced to form an NADH. So what happens here is NAD plus is decreased and NADH is increased. So thus what happens is that if a person consumes too much alcohol, then there will be deficiency of this NAD plus because for the metabolism of alcohol, the NAD plus is used up. So due to the deficiency of NAD plus, there will be accumulation of fat in this liver cell. This is because the NAD plus is required for the oxidation of fatty acid. And if NAD plus is not there, the fat will not be oxidized, the fat will be accumulated, and thus this can lead to a fatty liver. And also, see, the NADH is increased and NAD plus is decreased. So the NADH and NAD plus ratio will be increased. So due to the more NADH, what happens is that so after the glycolysis, pyruvate is formed, right? The pyruvate can enter into the TCA cycle, or it can form a lactic acid by the enzyme lactate dehydrogenase and by using this NADH. So due to more amount of NADH, what happens is that there will be increased production of this lactic acid. So this can lead to lactic acidosis. So the two toxic effect due to the depletion of NAD plus is fat accumulation in the liver. Thus there will be fatty liver. This is a complication, and there can be lactic acidosis. And now coming to the second toxic effect, that is generation of reactive oxygen species. Where does this happen? So it is happening in this alternate enzyme system. That is when the alcohol concentration is too high in our blood or in our body, what happens is that within the liver, not only the alcohol dehydrogenase will be involved in metabolism, there will be some other enzymes. That is, in the microsome, we have the cytochrome P450E1 enzyme. This enzyme will also be involved in the conversion of ethanol to acetaldehyde, so thus making the metabolism of alcohol more easier. So in this process of see, an NADPH is utilized, NAD plus is produced. But that's not the problem here. See, here some reactive oxygen species are produced. So due to the production of this reactive oxygen species, there will be lipid peroxidation of the hepatocyte, that is of the liver cell membrane. So the membrane will undergo lipid peroxidation, the lipid will be destroyed. Thus the hepatocyte will be destroyed, and this can lead to a hepatocellular injury. So this is a second toxic effect. And now coming to the next one, that is acetaldehyde toxicity. So the first step of alcohol metabolism is that alcohol becoming acetaldehyde. And in the second step, this acetaldehyde becomes what? Acetic acid, that is acetate. So for this we need an enzyme, that is aldehyde dehydrogenase. But the problem is that the aldehyde dehydrogenase is actually less efficient in some people. There are genetic variation for this functioning of this enzyme. Actually, in most of the Asian population, the aldehyde dehydrogenase enzyme is less efficient. So what happens is that there will not be conversion of all the acetaldehyde to acetic acid. Suppose if the person is alcoholic, is a chronic alcoholic, then there will be more acetaldehyde, right? So the conversion of acetaldehyde to acetic acid is not in proportion with the acetaldehyde which is already there. That is, there will be more acetaldehyde production. So due to this, the acetaldehyde will be accumulated in the liver cell, and due to the accumulation of acetaldehyde, there will be what? Acetaldehyde toxicity. The symptoms of acetaldehyde toxicity include flushing, that is, uh, redness of the skin, of face, anywhere. Then tachycardia and hyperventilation. There will be increased in breathing, decreased duration of breathing, likewise. And the next toxic effect is endotoxin release. So the alcohol is going to increase the gut endotoxin absorption. Actually, the bacteria, see, whenever a person is consuming alcohol, we know we have the in our gut, in our intestine, we have the bacteria, right? Bacterial flora, and they will be releasing the endotoxins, and this alcohol will be increasing the absorption of this endotoxins, and if once they are absorbed, they will activate the Kupffer cells and macrophages, and thus they will release the tumor necrosis factor cytokines, and they can contribute to liver injury. So these are some of the toxic effects of alcohol metabolism. First one is depletion of NAD plus, leading to fatty liver, lactic acidosis. Second thing is generation of reactive oxygen species, then acetaldehyde toxicity, and then endotoxin release. So this is all about the toxic effect of alcohol metabolism. So in my next video, I will be dealing with the disorders caused by alcoholism. So thank you for watching, and please like, share and subscribe. Thank you.